Hello, dear friends from all over the world. I am very, very happy to be invited to present my work in Global Summit. I am very, very honored to be a part of this great event. And not only, Kianor has created the American Academy of Oral Surgery, and as an ambassador, I will try to do my best in order to be able to share my knowledge and skills, not only about dentistry, but about facial aesthetics as well. My motto is stay young with your own blood. If we have a very safe, natural, easy, and cheap way to perform facial aesthetics, I think this is the best way to go, especially in nowadays that with COVID, we have lots of problems and we want to avoid anything artificial that might create any problem in our system. As you see, I have a lady here that I have done my treatment, Cleopatra technique, which I am going to present in the following slides. We did a treatment after the dental treatment from her dentist and the lab technician who made the overdenture. I did the facial treatment, and this is how she looks 2 years after without treatment. So if we have a natural way of rejuvenating the skin, even if we have to add some hyaluronic acid in some cases, this is very good, and this is very safe in order to give back the youth and not only the happiness that all of us deserve. If they come to our clinics, they come for smiles. They come to feel confident. They want to feel good. They want to smile. But if we are able to treat not only the teeth, the hard and the soft tissue inside the mouth, but the skin outside the mouth, this is very good in order to present not only our work, but to give back a positive psychology to our patients. Sometimes we have to deal with hard cases that we have to do oral surgery, we have to put implants, and of course, we can use PRF. PRF for me is a magic biological solution that can be applied in every field of oral surgery. And because I have all this experience, because I started with the blood derivatives back in 2003, I have seen that it's working in order to rejuvenate the bone and the gums. And of course, I had the idea to use PRF in order to rejuvenate the skin. So we can put it, and of course, we know we have the publications and the proof that can enhance the bone regrowth and the quality and the amount of the gums. In some other cases, even if we do vestuloplasty, we can use PRF in order to promote the soft tissue healing. In this case, we apply PRF and we see after 10 days that in the area that we applied the gel of PRF, the membranes, we have new vascularization. So we know from our experience in oral surgery that PRF is working in hard and soft tissue regeneration. We see the new blood formation, vessel formation, and we know that our tissue will have the oxygen and the ingredients in order to be healthy and young again. In some cases that we might have a trauma on a tissue, we can apply PRF, liquid PRF, in order to promote the soft tissue regeneration. So PRF is something that has long history, and of course, it's very well documented, and there are a lot of publications to support the benefits of PRF, platelet-rich plasma. You see how the upper jaw became, and we put implants in the lower jaw. You see how good quality of soft tissue we can achieve. And of course, the thing that we can achieve the most is the facial aesthetics in this lady. She came, she had lots of problems. She didn't like herself because she's a very beautiful lady. She wanted something in order to be able to have a good function and not only to have a better facial aesthetics. So this is our patient. She is happy, and she's happy because as a dentist, we didn't only rebuild things that they are inside the mouth, but we rebuild the skin as well. Now, the question is, can a dentist perform facial aesthetics? I think yes. And I think it's mandatory because whatever you do inside the mouth, veneers, you put the best materials, you put implants, you put overdentures, name it. If you really don't fix the perioral area, your work doesn't show the same. So let's talk a little bit about the aesthetic procedures. We have nowadays a lot of people worldwide, men and women, that are seeking a lot of aesthetic procedures. They want to look better. And if you look better, you feel better. So we can go either ways, in the surgical way and in the non-surgical way. And of course, the surgical way is the job of the plastic surgeons. It's not our job. As dentists, we can do the non-surgical way. And of course, if we start our journey to facial aesthetics, the best way to start is the blood, because with the treatment, with the blood, with the PRF treatment, with Cleopatra technique, there is no bad scenario. You cannot cause any harm to the tissue. And of course, all the patients are very satisfied. Now, if you have a patient in your clinic and you start talking about injectable aesthetic treatments, usually people know the non-autologous way, for example, the fillers and the botulinum toxin. Some, they are more educated, or they have searched different kind of aesthetic treatments. They're talking about the autologous treatments. And of course, from the autologous, everybody knows the fat sculpturing, but the fat is very beneficial due to the fact that it has the adipose stem cells, is an ideal space maker. And of course, if you can combine this treatment with the fat, with the blood derivatives, you can achieve 100% satisfaction from the patient. Now, if we're talking about the autologous way, and if we use the blood, we can do many treatments. We can go very slowly because we stimulate our own tissue to rejuvenate, and this needs time, compared to the other way that if we have the fat, we can fill up the lost space and the results are more immediate. Now, what is regenerative medicine? Regenerative medicine is something that is very well known nowadays. And of course, we're using the blood derivatives. There are different protocols, PRP, PRGF, PRF, which I love, and I think it's superior of all. And as treatments, they're very safe, they're non-toxic, they don't cause any allergic reactions, and of course, they don't harm the tissue. But nowadays, a lot of people are talking about the stem cell therapies, and of course, they are very promising because we use our own cells in order to be able to reverse the time and to start and feel young. Now, with Cleopatra technique, what do we use? We use the components of blood. We are based on a platelet concept. And of course, what do? It's simple. We take some blood from the peripheral vein, we put it in a machine, and we concentrate the components of the blood. And by doing this, we increase the platelet and the leukocyte count. But let's go back to see how many blood concentrates protocols we have. First of all, we have PRP from Professor Marks in 1998, platelet-rich plasma. A year later, from Anitua, we have the plasma rich in growth factors. And in 2001, we have the platelet-rich fibrin by Joseph Sucrut. But if we're talking about PRP, we don't have any consensus about the count of the cells, the speed that we centrifuge the blood, and of course the time. So there is a little confusion if we're talking about PRP for facial aesthetics. Now, PRF is a third generation blood concentrate. It stands the PRF for platelet-rich fibrin. And of course, this fibrin matrix is composed of a lot of regenerative cells. The new protocol is the low-speed centrifugation concept. And with this, we try to reduce the G-force. So we centrifuge the blood with lower rounds per minute. In this way, we're able to save more cells. We can get injectable IPRF because long time ago, we only had the gel type. And this injectable IPRF is a liquid which is enriched in white cells. So we have something which is very powerful. Here you see the evolution of PRF, and this is the magic about PRF that is changing for all the time in order to get the more advantages of PRF. So we have in the beginning the high-speed PRF, so we spin the blood in 708 G. And as we do a lot of research, we reduce the G-force down to 2008. And the low-speed centrifugation concept is with 60 G. So you see here that in the beginning, we had a few leukocytes and growth factors. And as we reduce the G-force, we can increase the count of the cells. So now we are able to have the IPRF plus. These are the new tubes that we're using in order to get IPRF plus. These are 13 ml. And of course, you see how much amount of this biological product we can get by increasing the size of the old tubes 30%. In this study, we see that with the injectable PRF, we can get better, greater cell migration and proliferation, and of course, collagen synthesis. And we can see in this diagram from control to PRP and IPRF that we can get more collagen type 1. But in the cases that we have an older person, we need to get more collagen. How can we do that? We can increase the fibrinogen, and this is the APRF liquid. This is a biological bioproduct that can fill the wrinkles. So this is very important because now we might not need the hyaluronic acid or any other filling material, or in some very rare cases that the skin is very dehydrated, it's very aged, maybe we can combine this biological product with hyaluronic acid. So nowadays, we are in the condition, in the situation, in a position to talk about scientific evidence in tissue engineering. So we can have the regeneration of the tissue. And how can we achieve that? We can build up new blood vessels, and the cells that are helping us for this procedure are the inflammatory cells, the growth factors, the liquid fibrin, and of course, the stem cells. Now, how the idea of Cleopatra technique started? We always use PRF combined with a trauma. I have seen this in the thousands of cases that I have done in oral surgery, because my profession is periodontologist, implantologist, and my PhD is about bone regeneration. So I was thinking, why not, if we traumatize the skin, to apply PRF, and of course, to have the benefits of PRF, either as IPRF plus or as APRF liquid. So Cleopatra technique actually is a combination of these very valuable biomaterials. This IPRF plus is full of cells. APRF liquid has more liquid fibrin. So we have the combination, and the liquid fibrin keeps the cells alive. So we have the slow release of PRF during the healing process. And of course, we have the benefits of applying to the wound additional PRF and giving to the wound, in order to be able to enhance the healing, we give like all the components of the blood. We have done a study, and we have used the telomere length in order to see the satisfaction of our patients that they have done this kind of treatment. And of course, this is very important because now it was something very new. I was the first one worldwide that I talked about PRF aesthetics in the book of Regenerative Dentistry from Joseph Choucroun and Rick Myron. And this is my second publication that shows that we can rejuvenate the lower face with the use of these liquid matrices. And I have named this technique Cleopatra technique. I have named this technique because, as you know, Cleopatra was a powerful woman. PRF is very powerful with long history. PRF has a long history. It has to do only with natural products, your blood, only the blood. So this is something totally safe. And of course, it has to do with beauty. I really believe that Cleopatra technique, as a name, is a very good marketing name, is a very good attraction to all the patients, that they want to look and feel beautiful. And I think as dentists, you can use this because all of our patients, they have us in their mind having knives or working with a drill. As a procedure, it's very simple, it's very easy, and it's very cheap, because money, especially in this hard time of COVID, is very important for all of us. you have to learn everything that has to do with the skin types, what is physiological and what is pathological about the skin. And before the treatment, you have to give instructions to the patient in order to prepare the skin. And of course, during the procedure, you will have pain if you don't anesthetize the skin topically. And we have many ointments for this reason. As dentists, we have the advantage to be able to do local anesthesia inside the mouth. So this is very good in order to ease the pain or eliminate the pain for our patients. And in rare cases, again, as dentists, we can do easily block anesthesia. Now the materials, we need to have the tubes, we need to have syringes or these simple syringes or syringes, Luer lock, and different kinds of needles in order to be able to inject PRF inside the skin. Now, the only thing that you should really know if you want to do this protocol is to know how to draw blood. One thing that I have to tell you, always just remember to disinfect the area because you don't want to transmit the bacteria from the hand inside the human body. And of course, as a procedure, is very easy if you learn how to do it, and you can learn it easily as a dentist. And of course, we have these butterflies that they make our lives easier. So with this treatment, we can rejuvenate the skin, we traumatize the skin, and we can do it either with a dermapen, we can do it with our syringe, or we can use derma rollers. Of course, you need to learn the procedure of microneedling. It's easy, but it has a lot of danger if you don't know how to use it, because you might macerate the skin, you might traumatize the skin in a bad way, and you might have some scar tissue. Now, the microneedling, if it's superficial, if you do it step by step, is the easiest way for you to start. And of course, what can we do? We can just apply, use the PRF, the liquid PRF, in order to lubricate the skin, and we can do the trauma with our dermapen. You see here the petechia here that we create with the microneedling. There are lots of techniques. Another technique, it can be point by point or micropapular technique. And of course, with this technique, you have your own syringe. You can use IPRF plus, you can use the combination of I and A, and again, you deliver this amazing bioproduct inside the skin. So you do two things, you traumatize and you apply PRF inside the skin. Now, after the treatment in this beautiful lady, we did microneedling and we did with a dermapen, and we did a micropapular technique. This is how the lady looks after the treatment. But in some cases, when the woman is over 40, the needs are more. So we have to restore the lost volume, we have to eliminate the wrinkles, we have to do the contouring of the lips and the face, we have to correct the asymmetries. In some cases, people have acne scars or keloids. So with these cases, we have to be more aggressive, we have to repeat the treatment more times, and of course, we have a lot of different tools, different lengths of needles, different sizes, and if you're an experienced doctor, you can use a cannula. Now, the thing is, what is PRF? PRF is your own blood. So you can use it for every skin type, for every age, and for both male and female. So this is something that it's for all of us. It's easy, but the only thing you have to have in mind is that you have to give time to the skin to go through the phases of the tissue healing, like the inflammatory response, the proliferation of the cells, the tissue healing, and not only the tissue maturation, which is going to be up to 2 years. Now about the protocol, again, very easy. If our treatment is more superficial, like we use a dermapen that the depth is 0.25 millimeters to 1.5, then we can do the treatment every 15 days. But if we go aggressively, 2 millimeters and deeper, we have needles of 13 millimeters, 20 millimeters, then we traumatize the skin more. So we can do the treatment once a month for 3 to 4 sessions. Then after that, you put the patient in a recall. The recall, of course, has to do with the demands of the skin, the demands of the patient, the lifestyle. And you have to have in mind that the younger people need less treatments, and these treatments, they last longer. If you have an older person, then you have to repeat the treatment more often. Let's say every 3 months. Now, when we finish the treatment, we can put a face mask. These are my patients with a face mask. And why they put their fingers like that? Why? Because they're very satisfied after the treatment. You feel like redness. You have an increase of temperature on your skin. You feel like the skin is getting too tight. And by putting this mask, which is full of ingredients, then you feel much better. You can put just eyes, but I prefer to put face mask, or you can additionally give to your patients low-level lead therapy or low-level laser therapy. And of course, as I said, for me, the face mask is more beneficial in case it has like hyaluronic acid, vitamins, peptides, because what we can do, we can reduce the edema and the redness. But the question is, what do we tell to our patients to do after the treatment? They can put ice pads on the area that we have treated the face in order to reduce the edema. Again, the only thing that I have to have in mind, not the patients of Cleopatra technique, but every patient who is doing aesthetic treatment, to avoid the sun exposure. After the treatment, right after the treatment, to avoid the heavy exercise, to avoid the sun exposure is for everybody, for all our lives. They have to wear sun protection cream. We have to wear sun protection cream in order to protect our skin from the X-rays of the sun. And of course, they can use this arnica ointment in order to put it on the skin and reduce the bruising. Or they can use Bepanthol cream in order to hydrate the skin after all this treatment. And they can do it 3 to 4 times. As I said before, maintenance, it has to do with the skin condition, with the age of the patient, with the lifestyle of the patient. If the patient smokes, for example, okay? If they don't drink water, if they don't exercise. So the treatment is not so satisfactory compared to somebody who has a very a good lifestyle, eats well, exercises, drinks water, takes care of the sun, because this treatment has to do, is a tailor-made for every individual. Let's see some cases. We can have very natural, very authentic looking. We don't change anything, but we enhance the lips, we can enhance the contouring, the volume, and the shape, but we keep the authenticity of the face. And of course, in this lady, we can rejuvenate the perioral area. And not only, we can give some volume back to the face, but in these cases, we have to go with more aggressive treatments. We have to use cannula, we have to repeat the treatment, and of course, we can combine injectables inside the skin and treatment on the surface of the skin. This is again another case that I did Cleopatra technique 4 times, and you see the improvement in the area of the forehead and around the eyes. But as I said before, in some cases, we have to use hyaluronic acid. Hyaluronic acid is a natural polysaccharide. It is in our body. The benefit of this product is that it can absorb 1,000 its own weight, so it gives us more hydration to the skin, so the skin looks younger, and it has a very glamorous, very nice, very glow appearance. I did this case in the beginning with only the blood, with only Cleopatra technique, and this is how far I can go. So next, I combine Cleopatra technique with liquid PRF, so you can see gradually the improvement of the face. And this is how the patient is looking after the combination treatment. And in this case, I have achieved facial aesthetics by doing a combination of dental work and facial aesthetics with my technique. A lot of people, they're asking me if we can combine PRF with any other treatment. PRF can be combined with everything from chemical peels to lasers to fat transplant. We can use it everywhere. Why? Because it's our own blood and we know all the benefits of the blood. For example, this lady had done my treatment, and after that, I put her under the low-level lead treatment in order to help her calm down after the treatment and reduce the edema and the increase of the temperature after the microneedling treatment. This is another case that I use the PDO threads in combination with Cleopatra technique. And of course, a lot of people are asking me about the botulinum toxin. If you want to do Botox, you have to do the Cleopatra technique PRF treatment before, and then wait for a month and then do Botox. If, for example, you do Botox and right after you do Cleopatra technique, then you know that this Botox will be wear off very soon because in this area you have created more microcirculation. In this case, this lady came to me, I did Botox, and I saw how much problematic was the skin of the forehead. She had pigmentation due to the chemical peels and of course to a lot of sun exposure. After that, I decided to do 4 treatments with PRF, and you see that I could eliminate the pigmentation and I could rejuvenate the skin of the forehead. Of course, if you are able, like Dr. Brazzini from Nice, you can combine the treatment using PRF and fat. This is ideal because you can stimulate the skin regrowth, you can fill up the lost space with the fat, and by having the adipose stem cells, you achieve nice, quick, excellent, not nice, excellent, quick results that they can stay up to 10 years. But sometimes when we do facial aesthetics and we use other materials, we might have complications. This is an article that we did together with Professor Ganati. So this lady had put hyaluronic acid in the temporal area. She got in a big infection in both sides. So she had to excise surgically the infection, and she had this appearance of the skin with the fistulas. So by injecting PRF, we could change the quality of the skin. So for me, PRF is very powerful, and it can be a cure in some cases. We can use it for wound healing, like in these cases that we have amputation. So we clean the wound, we apply PRF, and of course, we can see how quick healing we have in 30 days. My patient had a big burn on her breast. 15 days, these couldn't close, couldn't have any healing as a trauma. So she had lots of pain. You see there is a lot of bleeding, not a lot, but there is bleeding here when the skin was touched. So I decided to put PRF membranes and PRF liquid. I clean the wound with saline water. I apply PRF, and this is a photo that she has sent to me 2 days after, when she removed the PRF, and this is how the skin looks a week after. We can use IPRF Plus in order to rejuvenate, to have regrowth of hair, and you see some cases here. And of course, we can use IPRF Plus in order to treat some arthritical problems for the knee, for example, or for the fingers. And we can inject IPRF Plus inside. And of course, the results are very promising because we can increase the mobility of the hands in this case, and of course, decrease the numbness and the pain. Right now, I am in a situation that I am in Athens, Greece. I cannot travel to other countries, and people cannot come to my country for my courses. A long time ago that we had the privilege, we had a lot of people coming to Greece. We could work on live patients, share knowledge and techniques. But nowadays, due to COVID, we have to do a lot of things from long distance. So if you want to keep in touch, follow me on my social media like on Facebook. I have profile, I have pages, Cleopatra Technique for Aesthetics and Cleopatra Technique for Aesthetics too. And I have 2 groups, they're totally free. You can get a lot of information, Wax Aesthetica and Aesthetica by Cleopatra Nacopoulos. And I organize nowadays a lot of hands-on courses, and the training is through Zoom. So we together do the technique step by step. This is a combination of my technique and hyaluronic acid. And thank you very much for your attention. I hope from the bottom of my heart to be able to be able again to visit you in your countries. I have taught thousands of people. I have visited hundreds of countries all over the world. And of course, for me, it's very valuable to be able to be in touch in person and share what we love. Thank you very much. Stay safe, and let's hope that we'll meet again soon. Thank you.